Okay, so we are going to start with reproductive module, embryology. इसमें सबसे पहले we have important genes of embryo-genesis, in which we have sonic hedgehog gene, which is produced at the base of limbs in zone of polarizing activity and involved in patterning along anterior posterior axis, involved in CNS development. Mutation can cause um, holoprosencephaly. Let's highlight it with red. Okay, so we have to see what is the um, polarizing zone of polarizing activity. Zone polarizing activity. Special region of mesenchyme in the posterior limb bud that directs anterior posterior limb patterning to sonic hedgehogs. Okay, so it is a region of mesenchyme in the posterior limb bud that directs anterior posterior limb patterning. And the anterior posterior axis involves the sonic hedgehog gene. It is involved in CNS development as well, and mutation can cause holoprosencephaly. Um, okay, so we have images for zone of polarizing activity. Let's see them. Posterior margin of limb bud specifies polarity of limb field, specifies existence of limb field. Okay, so the zone of polarizing activity acts here and causes the development of secondary AR and I guess primary AR. And there they have shown an implant. All right. And then we have the search holoprosencephaly. Mm. It says holoprosencephaly is a congenital effect of forebrain and midline structures. Okay, so forebrain and midline structures. And I'm supposing that holoprosencephaly is associated with CNS and sonic hedgehog. Accurate sonic hedgehog. That's so funny. Okay. Really? Really? The gene. You're talking about the gene. Why is it called that though? Okay, wait. That's interesting. As well known for its quirky name as for its function, it includes cell proliferation and tissue-specific distribution and is expressed in a notochord, the brain zone of polarizing activity of developing limbs. Well, this is funny. Mutations or deletions of SSH cause holoprosencephaly, in which the primary effect is incomplete cleavage of the developing brain into separate hemispheres and ventricles. Okay. Great. So we know that sonic hedgehogs produced at the base of the limbs in the zone of polarizing activity. It is important for the CNS development and for limb development, and it causes holoprosencephaly. Next is the WNT7 gene, produced at apical ectodermal ridge, second ectoderm at distal end of each developing limb, necessary for proper organization of dorsal ventral axis. So it is produced as apical ectodermal ridge, and it is important for dorsal ventral axis. Then we have FGF gene, produced again at the apical ectodermal ridge, stimulates mitosis of underlying mesoderm, providing for lengthening of limbs. This is all about limbs, kind of. And then there's the HOX or homeobox genes involved in segmental organization of embryo in a craniocaudal direction, code for transcription factors. HOX mutations cause appendages in wrong locations. Okay, it is basically for the segmental organization of embryo. Now we search the apical ectodermal ridge. Thicken layer of cells at a still type of developing limb organizing region, and it is a transit. Okay, and right. So W97 genes act on the apical ectodermal ridge for dorsal ventral axis organization. FTF gene acts on apical ectodermal ridge for lengthening of limbs, and homeobox gene is for the segmental organization in a craniocaudal direction. Next, we have this early fetal development. So, like this, we have this diagram. It shows that there is fertilization at day 0, zygote formation by day 2, and by day 3, there is a morula, or by day 4, you can say, as 4x4 is equal to 16, and morula is a 16 cell structure. Day 5 or 6 is the blastocyst, as in blasto6, and the blastocyst then implants in the endometrium by day 6 and 10, and the endometrium is part of the uterine wall. Okay, so far so good. Day 0, this is fertilization by sperm forming zygote and initiation of embryo-genesis. Within week 1, this time period, HCG secretion begins around the time of implantation of blastocyst, sticks at day 6. Okay. So week 1 is basically day 1 to day 6, and the HCG secretion begins around that time of implantation of blastocyst. उसके बाद there is within week 2 there is a bilaminar disc. Epiblast and hypoblast. 2 weeks is equal to 2 layers. Within week 3 there is a trilaminar disc and gastrulation. There's primitive streak, notochord, mesoderm, and its organization, and neural plate begin to form. Weeks 3 to 8 is the embryonic period. Neural tube formed by neuroectoderm and closes by week 4. There's organogenesis and extreme susceptible to teratogens. We remember it by week 3 to 8. Teratogens is 4, so like 3, 4, 8. 4 is teratogens. And neural tube formed by neuroectoderm and closes by week 4. And similar is its association with teratogens. Week 4 is when the heart begins to beat. Heart has 4 chambers, so week 4, upper and lower limbs begin to form. 4 limbs, 4 weeks. Week 6 is fetal cardiac activity visible by transvaginal ultrasound. Week 10 genitalia have male and female characteristics. Okay, gastrulation is a process that forms trilaminar embryonic disc, establishes the ectoderm, mesoderm, and endoderm germ layer, starts with the epiblast invaginating the formally primitive state. Okay, starts with the epiblast invaginating the formally primitive state. So, like, the epiblast. Looks like there are no diagrams here. Okay. These are for the twins. Looks like there are no diagrams here. Wow. Okay, so we have the we were searching for the epiblast. Okay, so the epiblast. Oh my god, epiblast. All right, this is the epiblast. And when the cellulose kind of invaginates to form a primitive state, it causes the initiation of granulation, gastrulation, gastrulation. In the embryonic germ layers are ectoderm, mesoderm, and endoderm. Ectoderm has further been divided into surface ectoderm, neuroectoderm, and neurocrest cell. So yeah, there is the epiblast, the hyperblast, and the trophoblast. The epiblast kind of invaginates inwards, and when this invaginates, it forms a primitive streak up here, like this, and this causes the initiation of gastrulation. So in ectoderm, we have surface ectoderm. Ectoderm is the external or outer layer. It causes the formation of epidermis, adenohypophysis from Rathke's pouch. Okay, so bootcamp said that ectoderm reminds of beauty and brains. So everything that is related to beauty and brains, beauty being in surface ectoderm and neuroectoderm being in the brains, neurohypophysis, CNS neurons, oligodendrocytes, astrocytes, the neurohypophysis is part of the anterior pituitary. And then the CNS neurons, oligodendrocytes, astrocytes, ependymal cells. These are the type of cells of the CNS, and the pineal gland, the gland of the CNS, the gland of the brain. Then there's retina and optic nerve, which are also extensions of the CNS, and the spinal cord, which is also part of the CNS. So neuroectoderm is linked with CNS. And then we have surface ectoderm. It has epidermis, adenohypophysis from Rathke's pouch. There's an interesting differential here that the retina of the eye is formed by neuroectoderm, and the lens of the eye is formed by surface ectoderm. I mean, it's the ectoderm. But yeah, epithelial linings of oral cavity. Then there's sensory organs of ear and olfactory epithelium. Epidermis, again, anal canal below the pectinate line. This one is kind of an anomaly again. And since neuroectoderm had pineal gland, this one has parotid gland, sweat, and mammary glands. All right. So epidermis, adenohypophysis, lens of eye, epithelial lines of oral cavity, for beauty, and then sensory organs of ear and olfactory epithelium. Anal canal below the pectinate line is made from surface ectoderm. This is an important one to remember. And parotid, sweat, and mammary glands. Parotid in the face, sweat in all over the body, and mammary glands in the breast. Craniopharyngioma is benign Rathke pouch tumor with cholesterol crystals and calcifications. Okay. Craniopharyngioma. Okay, there are some MIs of it. Craniopharyngioma, I think they are more high imaging. Characteristic imaging finding of craniopharyngioma in a child is an enhancing supracellular mass that is calcified and cystic on CT. When 2 out of 3 features are present, craniopharyngioma is still the most likely diagnosis. Now, what I want to know is, tumors derived from epithelial rest is comparable to an imperfect closure of the hypophyseal or craniopharyngeal duct. This ontogenic tumors with benign histology and malignant. That's such a hard term to use online. No, craniopharyngeal. I want to see craniopharyngioma. Yes, there's a solid cystic tumor arises from remnants of craniopharyngeal duct. Tumor invades the sella turcica and displaces neighboring structures, that is pituitary gland, bimodal age distribution, first peak between 5 to 15 years and second peak between 50 to 70 years. Oh, that's like so cool. Okay. And then there's epithelial tumor derived from Rathke's pouch. This thing that we were talking about. Yeah. Adamantinomatous type is most common in children. Papillary subtype occurs most often in adults. No gender predilection. Symptoms can include cognitive impairment, nausea, vomiting, and somnolence. Remnants of Rathke's pouch is all over. It's important for MCC of hyperpituitary in children, compresses both optic chiasma and hypothalamic. Yes, that's important. what we need to know is that it is a benign Rathke's pouch tumor with cholesterol crystals and calcifications. Here comes a red mark. Benign Rathke pouch tumor with cholesterol crystal and calcifications. It is related to the surface ectoderm. Because adenohypophysis is from Rathke's pouch, so the benign Rathke pouch tumor, they have this right next to it, spheniopharyngioma. Next, we go to neural quest cells, which are not like, which could be like, they're like so important, they could be called the fourth germline. The first is derivative is PNS, okay. Dorsal root ganglia, cranial nerves, cilia ganglions, Schwann cells, and ANS. Okay, so PNS, the first cell that we have is Schwann cells, all right. The nerves, the cilia ganglion, the dorsal root ganglion, and the ANS, autonomic nervous system. Melanocytes, chromaffin cells of adrenal medulla, okay. Perifollicular cells of thyroid, pia and arachnoid from the brain, bones of the skull, odontoblasts, corticopulmonary septum, which is these two are like really, really important. Neural quest, think PNS and non-neural structures nearby. Okay, so when we think of PNS, there is dorsal root ganglia, cranial nerves, cilia ganglion, Schwann cells, and ANS. And the structures nearby, I think, would be the thyroid gland, and it has parafollicular cells. Then obviously it would have sheets of pia and arachnoid. And then the bones of the skull right above the spinal cord, and then there'd be odontoblast in the which will form teeth in the mouth, and then below that is the ortical pulmonary septum. It's like you go from backwards behind your body, dorsal surface to the top of it, and then downwards. And then we have like at the very bottom we have the chromaffin cells of adrenal medulla. Mesoderm is the second layer of second of the germline derivatives. It forms the muscle. Okay, so there are like different layers to the mesoderm as well. And these are the axial. The axial, okay, wait. I'll actually search it out. Um, mm, mm. This one, okay. So, oh, wait a minute. Wait, where did my picture go? Yeah. What? Why does that keep happening? I need my picture. No, I need my. Oh, yeah, this. So annoying. Okay. So this is the mesoderm. This is the neural tube. This is the notochord, and this is the surface ectoderm. Now this is the mesoderm, which is the middle layer, and this is the endoderm. In the mesoderm, there is like this. It's like an octopus with its limbs out there. So the head of the octopus is called parietal mesoderm, and then there's this part connecting the head to the limbs. It's called the intermediate mesoderm. And then there are two limbs. The upper limb is called somatic layer of lateral plate mesoderm, and then lower layer is called splanchnic layer, lateral plate mesoderm. But they can both be called the lateral plate layer of the mesoderm. And then there is a coelom in between them. So that's pretty nice of a diagram. So now I wanted to say that the paraxial or the axial, the first of all, there's the axial mesoderm. The axial mesoderm forms the notochord, and it converts the notochord to be converted to the nucleus pulposus. Notochord induces ectoderm to form neuroectoderm. Its only postnatal derivative is the nucleus pulposus of the intervertebral disc. So yeah, the axial mesoderm causes the notochord to be converted to the nucleus pulposus of the intervertebral disc. Then comes the paraxial mesoderm. The head It causes the formation of vertebra and ribs. Let's see where they are. They have not written it here, I think. But yeah, they're derived from the parts of the mesoderm. And then comes the intermediate mesoderm that forms the kidneys and the gonads, testes and ovaries. Okay. And then we have the electroplate mesoderm that forms the microglia, limbs, and stem cells of the mitochondrial system. Right. Microglia. Hmm. Not written microglia, which is very shocking. Microglia, limbs, and cells of the hematopoietic origin. Okay, blood, we can say lymphatics. Um, so weird. There's no limbs, but limbs are formed from there. Okay, what we have remaining is muscle, bone, connective tissue, serous linings of body cavities, and peritoneum, spleen, derived from foregut, mesentery, spleen. Cardiovascular structures that not mentioned. Which ones? Wall of gut tube, all right, vagina, adrenal cortex. These seem to be important but different from those that I've mentioned already. Okay, so middle meaty layer mesodermal defects are vectoral, vertebral defects, anal atresia, cardiac defects, tracheoesophageal fistula, renal defects, and limb defects, bone and muscle. See, that's it said that there's a defect in limb development, but they've not said how come. So again, vertebral defects, anal atresia, cardiac defects, tracheoesophageal fistula, renal defects, and limb defects, bone and muscle. And we have enoderm. Enoderm is the gut tube epithelium, including anal canal above the pectinate line. Anal canal below the pectinate line is from the ectoderm. Most of urethra derived from urogenital sinus. There's luminal epithelial derivatives, example lungs, liver, gallbladder, pancreas, eustachian tube, thymus, parathyroid, thyroid follicular cells. It is an internal layer. So most of urethra, luminal epithelial derivatives that form the lumen from top to bottom. There's the lungs, then there's the liver, then there's the gallbladder right beside it, the pancreas right beside that, and the eustachian tube in the ear, which is very funny, but you have to remember it. And then there's the thymus, parathyroid, thyroid follicular cells. These are part of the head and neck structures. Each of them got through glands, like except mesoderm, because mesoderm is a meaty layer and it don't form the glands. Then we have the types of organ morphogenesis or formation. The first is agenesis, which is an epson organ due to epson primordial tissue. Then there's aplasia, which means it's epson organ despite the presence of primordial tissue. Hyperplasia is incomplete organ development. Primordial tissue is present. There's incomplete organ development, but primordial tissue is present. Okay. So basically, it's like there's no primordial tissue, no development, no organ, agenesis. Primordial tissue, but still no organ, aplasia. Primordial tissue, organ, but incomplete. There's hypoplasia. Deformation is an extrinsic disruption from outward factors, occurs after embryonic period. Disruption is secondary breakdown of previously normal tissue. Okay, so there is like after embryonic period is complete, there's deformation. And then there's after embryonic period, there's a normal tissue, but there's a secondary breakdown. Example, in amniotic band syndrome. Oh, amniotic band syndrome. Let's see what that is. Amniotic band syndrome. Okay, so it is a set of congenital birth defects believed to be caused by entrapment of fetal parts in the fibrous amniotic bands while in utero. Amniotic bands, banding can cause amputation while in the womb. They constrict the blood supply of the fingers. And fetus at 16 months, amniotic constriction bands are caused by damage to the placenta called the amnion. Damage to amnion produces fiber-like bands that can trap parts of the developing baby. All right. So they are basically can we break down previously normal tissue or structure like the fingers. Next is an intrinsic disruption, which occurs during the embryonic period and is called malformation. All right. And the sequence is abnormalities that result from single primary neurologic events, example, oligohydramnios leads to water sequence. Okay, so far so good. Now, teratogens are most susceptible in 3 to 8 weeks. I said teratogens when 3, 4, 8, embryonic period or period of organogenesis of pregnancy before week 3 or in effects after week 8, growth and function are affected. The first are ACE inhibitors, they cause renal damage. We gotta search why do ACE inhibitors cause renal damage during pregnancy. And it says, their interference with the ROS, which is crucial for fetal kidney development and blood regulation. Okay, so they act with ROS, and ROS is important for fetal kidney development, essential for normal organogenesis for features, and is disruption by ACE inhibitors can lead to significant development issues. All right. Then there's alkylating agents that are used in the treatment of cancer. They can cause absence of digits and multiple anomalies. Aminoglycosides, a mean guy hit the baby in the ear. Okay, mean guy hit the baby in the ear. Reminds me of Baby's Day Out. So it causes CN8 toxicity, which is mainly vestibulocochlear nerve and associated with the ear. So yeah, pretty nerve tox. Then we have carbamazepine, facial dysmorphism, development and delay, neuroretinal defects, feelings or fingernail hypoplasia. So for carbamazepine, you've got to think about I also mentioned in the most latest, so you have to skip it. DES is very important. It causes vaginal cell carcinoma while in development, and it will also be important to mention it in Mendelian anomalies, which we'll discuss further. Then we have folate antagonists. All of us know it causes entities. Isotretinoin, multiple square defects, and contraception is mandatory with isotretinoin. Lithium Epstein anomaly, atrialized right ventricle. So Epstein anomaly is when there is atrialization of the right ventricle and the whole of the right ventricle and the becomes an atrium, essentially. That's called the Epstein anomaly. Methimazole is aplasia cutis congenita. We have to search what that is. Aplasia cutis congenita. This seems to be something of that. Shortly circumscribed open and whooping ulceration that may be covered by a thin membrane of crust. Usually smooth atrophic scar looking for hair collagen sign, neural tube defects, association with limb defects and genetic anomalies, between saline compressed, topical antibiotics, and sterile dressings, right? Oh, okay. Aplasia cutis congenita, and it is mainly caused due to methimazole use. Penetrating causes fetal Haydn joint syndrome, cleft palate, cardiac defects, swellings, fingernail hyperplasia. Something else we need to search is fetal Haydn joint syndrome. Haydn joint syndrome. Okay, what does it say? For tetracyclines, we have tetracyclines or tetracycline teeth. For thalidomide, it is for the limbs. For comelia microneal. Whenever you see limb, remember thalidomide. Valproate is an inhibition of maternal folate absorption and causes entities. Inhibits folate absorption. Valproate, 8 folate. Warfarin, bone deformities, fetal hemorrhage, abortion of physiologic anomalies. Do not wage warfare on the baby. Keep it happy with heparin. Does not cause losing. Okay. So we do not use warfarin. It is contraindicated in pregnancy because it crosses the placenta and can cause coagulation in the fetus, which can lead to bone deformities and eventually abortion and ophthalmologic abnormalities. We were discussing phenytoin, fetal height-in-toin syndrome. It causes short palpebral fissures, flat midface, short nose, indistinct philtrum, thin upper lip, micrognathia, minor ear anomalies, low nasal bridge, and epiphyseal tray. So that's what phenytoin, basically entoin, fetal height-in-toin syndrome, cleft palate, cardiac defects, and phalanx of fingernail hyperplasia. Then we have substance abuse. Alcohol is a common cause of birth defects and intellectual disability, and it causes fetal alcohol syndrome, which is the leading cause of intellectual disability in the US. Newborns of alcohol-consuming mothers have increased incidence of congenital anomalies, including pre- and postnatal developmental retardation, microcephaly, facial anomalies, smooth philtrum, hypertelorism, limb dislocation, heart defects, heart-lung fistulas, and holoprosencephaly in most severe form. Holoprosencephaly was basically caused because of sonic hedgehog syndrome, and I think the alcohol is basically affecting the SSH as well. And mechanism is failure of cell migration. It prevents the cell migration. Oh, so it's like sonic hedgehog genes are produced in one place and then they migrate to another, and fetal alcohol causes the sonic hedgehog genes to not travel, and this can cause failure of cell migration, heart-lung fistulas, holoprosencephaly, and facial anomalies, including smooth philtrum and hypertelorism, limb dislocation, heart defects, and all that. And that is what fetal alcohol syndrome is about. Cocaine is abnormal fetal growth and fetal adduction, placental abruption because of vasoconstriction. Smoking, nicotine or carbon monoxide causes low birth rate, leading cause in developed countries. Preterm labor, placental problems, IUGR, ADHD. Nicotine causes vasoconstriction and carbon monoxide causes impaired oxygen level. So it basically causes low birth weight, LBW, placental problems, IUGR, and ADHD. Others are iodine lacrixis causes goiter or hypothyroidism. All of us know that iodine's got effect with thyroid and cause goiter or hypothyroidism. Maternal diabetes causes caudal regression syndrome. Okay, genital heart defects and neural entities. So we have to see what caudal regression syndrome is. There it is. It is a very rare syndrome, which is called the maternal diabetes. Series of anomalies, including complete or partial genesis of sacrum and lumbar vertebrae associated with pelvic deformity, is associated with presence of two umbilical arteries, non-lethal venous anomalies, non-fused lower limbs, abdominal wall defects, and abnormalities of tracheoesophageal tree, neural tube, and heart. Patients with this have low motor function below the level of remaining normal spine, but sensation tends to be present more probably. That's okay. So caudal regression syndrome is associated with maternal diabetes, anal physiatric which is a condition of the fingers, I believe. Congenital heart defects and entities for diabetes. It is heart, there's brain, there is anal physiatric. Vitamin A access can cause extremely high risk for spontaneous abortions, and birth defects, cleft palate, and cardiac X-rays can cause microcephaly, intellectual disability, and it is minimized by lead shielding. You use lead shielding to prevent the intellectual disability and microcephaly that X-rays can cause. Okay, moving on to twinning. So dizygotic twins rise from two eggs that are separately fertilized by two different sperm. Okay, there's monozygotic and there's dizygotic. For dizygotic, there's two cell stage, different, like two eggs that are separately fertilized by two different sperm. And there's always two zygotes, and we'll have two separate amniotic sacs and separate placentas. And monozygotic arise from one fertilized egg that splits into two zygotes in early pregnancy, and the degree of separation between monozygotic twins depends on when the fertilized egg splits into two zygotes. So the timing of the separation determines the number of chorions and the number of amnions. So there's a two-cell stage, and that happens in 20% of the cases. At two-cell stage, there can be cleavage, but the placenta will be fused. or it can be separate as well. And it is dichorionic and diamniotic, which means that they share a chorion and an amnion. If it happened at the stage of morula, after the stage of morula, it is going to have, each fetus is going to have their own chorion, but the same amnion. Oh, I was wrong there. So when it happens after two-cell stage, each fetus is going to have their own chorion and their own amnion. And so there's going to be two chorions and two amnions. And if it happens at the stage after morular development, there's going to be two amnions and only one chorion. And if it happens after blastocyst, there's going to be one chorion and one amnion that is holding the fetuses. And if the cleavage occurs after the development of embryonic disc, there's going to be one chorion, one amnion, as well as the twins are going to be conjoined. And if none of that happened, there would be no twins. We can and go to the aortic arches.